Hi, this is Bruce Bair. I'm a physician assistant and I am the owner and author of the Physician Assistant Path, a blog and a compilation of services including medical Spanish and pre-PA coaching for people wanting to become physician's assistants. Now, I want to answer the question today, what is a physician assistant? This is something you're going to have to answer when you get an interview, and something that you're going to want to know if you don't know what PAs are and have heard of them and are maybe considering the occupation. This is the website for the Bureau of Labor Statistics, okay? It's the Occupational Outlook Handbook 2010-2011 edition. It comes as a PDF. If you want it, you could get it and download it. And it talks about physician's assistant's nature of the work, training, employment, job outlook, etc. So let's look at the significant points. Requirements for admission to training programs vary, but most applicants have a college degree, and some work in health-related and some health-related work experience. So most of them have done something in the health field before they get in. Physician's assistant must complete an accredited education program, pass a national exam to get a license. Employment is projected to grow much faster than average. We'll look at that in a moment. Job opportunities should be good, particularly in rural and inner city healthcare facilities. So if you want to do primary care, and that's what all these programs say, you must have a commitment to primary or rural inner city care when you go to their program. That's really a requirement for them getting federal funds. They don't get it if they aren't oriented that way, and it's been that way since I went to school in the 70s. Alright, so they practice medicine under the supervision of physicians and surgeons. And it's an important point. They are dependent practitioners, not independent practitioners. Even if a state allows a PA to own a practice, they must have a supervising physician help them comply with state regulations for physician assistants. Physician assistants are not medical assistants, who are a different kind of person working in medical offices and hospitals, who also assist physicians but who do not do the things that physicians do. Physicians do not do what physician assistants do, PAs are trained to provide diagnostic, therapeutic, and preventative healthcare services delegated by a physician, either delegated directly by word of mouth, I want you to do such and such, or delegated as part of standing orders and protocols as outlined in state law. You can, as a PA, you're going to take a history, you're going to examine and treat patients, you're going to order and interpret laboratory tests and x-rays and make diagnoses. And you're going to get better and better with it over time. They don't call it the practice of medicine for nothing. So when you get out of school, you're just ready to start practicing. You really just have a good knowledge base, hopefully, when you get out. PAs treat minor injuries. They suture, splint, and cast, and follow those injuries from initial first aid to discharging the patient. They keep medical records, they instruct and counsel patients, and they order and carry out therapy, and they also can prescribe certain medications. In North Carolina, except where the FDA has mandated that any practitioner must have a special license for certain medications, I can prescribe any medication, no matter what its schedule, unless it has that caveat attached to it. But the caveat of the Medical Board of North Carolina is I can't prescribe anything that my supervising physician would not prescribe. So even though I may be trained in drugs for neurology, if my supervisor doesn't treat MS, even though I might know how and be very good at it, I may not treat MS. So it just depends on the state law. Now, some of them work independent. My first job out of school was as a very dependent practitioner with very close supervision. But after a year, I left there and went to the most independent situation that you can imagine, rural eastern North Carolina in the 70s. Only just a few docs in the whole county, and my docs were about 10-15 miles away, and I was seeing walk-in and scheduled patients in a rural area where I got to see all kinds of stuff. Okay. So PAs work in primary care specialties like general, internal medicine, pediatrics, and family medicine, and all specialty areas according to the American Academy of Family Practice. I'm going to make another video about job expectations, etc., but this should answer the question, what is a PA? And this is Bruce Bair from the PA Path, signing off.